We're talking with Dr. Kevin Law, Doctor of Dental Surgery, and we're going to be talking about advances in dentistry. Kevin, welcome to the Dr. Bob Show.
Thanks, glad to be here.
I've had your daddy on the Dr. Bob Show several times, and I've been so excited about having you here. You're a doctor in dentistry. What are some of the advances in dentistry in the last several years?
Well, thanks for asking. I think one of the main things that we need to focus on is dental implants are really changing the way that we restore teeth in ways we haven't been able to before.
So dental implants. Now, what is a dental implant?
Well, a dental implant is a piece of titanium, kind of like the rods and pins that are placed in other parts of the body. This piece of titanium, usually in dental instances, is like a screw, and we can actually put it into a jawbone, whether it be the upper jaw or lower jaw.
So it's a titanium screw. You can put either in the upper or the lower. How big is it?
Well,
can't be that big.
Yeah, no, they're small.
Typically,
we usually do millimeters in dentistry. So usually somewhere around 10 millimeters long and anywhere between 3 to 6 in width. So that's our typical size.
Good. Is it hard to screw in?
Well, no, it's not hard to screw in. Typically the surgeon that's placing the dental implant makes a pilot drill, just kind of like you were hanging a picture on the wall. We make a pilot drill and then we make it larger and larger until we have the size implant that we need, and we can just screw it right in.
So you put a little hole, a bigger hole, and a bigger hole on top of that till it can receive the screw.
Precisely.
The titanium screw.
Yes, sir.
Now, you got a screw down there. Where's the tooth come in?
Well, that's a good question. We can't always just put a tooth on top of that screw once we put it in the jaw. Sometimes we need it to heal. That healing time can take between 4 to 6 months, and at that point, it's healed and it's really a part of the bone at that point. We can put a tooth or a denture or all kinds of different things. They're really dynamic.
So if you've got a screw in the lower jaw, we'll say for instance, and you've got to let the bone hook onto that titanium screw, do you have a vacant place there? Or you put an artificial tooth while you're waiting for it to hook onto the bone?
Well, every case is a little different. Sometimes somebody doesn't have any teeth at all, and at that point we don't have to worry about preserving the space where that tooth was. We just let it rest until we can use it maybe to hook it on a denture.
Let's say I played football and I got my front 4 teeth just knocked out, and I've got in a prosthesis in there, and I've got 4 teeth there, but I'm sick and tired of taking them out, and I want some dental implants. Am I a candidate?
Absolutely, you're a candidate. There are not a whole lot of contraindications to implants, so almost everybody can have them, but it's really important that we have a good medical history and also dental history before we do them. But yes, exactly, we can replace 1 tooth at a time, 2 teeth, 3 teeth, and restore those teeth that you were talking about.
If I had 4 teeth knocked out, what do you have to do about figuring out how far apart it is and what you're going to... Every case should be an individual. How do you individualize the cases?
That's a great question. Well, what we do is first you'll see a restorative dentist, somebody that's going to put teeth on top of those implants, and they'll sort of be the ones that quarterback planning where the implants are going to go and make sure that they're the right amount of space between each other and between the adjacent teeth that you already had, and really making sure that it's planned well so we can put a tooth on top of it that looks natural.
I hadn't thought about that. You just can't put 4 teeth in. Do you put them all together? Are they all lined up together? You put 1, 2, 3, 4 in.
Well, they have to be very precisely placed so they don't look like they're coming out like buck teeth. We don't want that, or coming in a way that maybe you couldn't chew with them very well. So we need to carefully plan that they're parallel to each other and that we can have really nice restorations that way.
Where is the most common place to put a dental implant? Is it in the front teeth because that's what people see, or is it the lower or the upper or the molars or the incisors? I'm trying to impress you that I know the names of molars and incisors.
Very impressed.
Where's the most common place?
I guess the place that we're seeing them the most now are with people that don't have any teeth. I guess with attaching these implants to dentures, full dentures. So we can take an implant in their jawbone, and a lot of times the dentures will have a little housing in it. And on top of the implant, we can put almost like a trailer hitch attachment so it'll snap on. So especially helpful in a lower denture so it doesn't slide around with the tongue and the cheek.
Now, I see in all the commercials and advertisements, you have special kind of stuff to make the denture stick on there. I take it when you get a dental implant, it's there. And I mean, it's solid as a rock.
Well, there's different ways we can do it, but however we do it, they're certainly a lot more stable. The more implants we do, typically the more stable they are. We can make great advances even with as little as 2 implants to hook them on a denture.
Can you figure out the color of the teeth exactly like the person wants? Can you give me a nice white smile there?
Well, everybody wants different things. Some people want toilet bowl white teeth, that movie star smile.
That porcelain white.
Porcelain white, exactly. And then other people want more of a natural look. So that kind of comes into play when we first meet the patient and we're discussing what their expectations are.
Once you've put in an implant, can you forget it? Are you going to be able to get cavities there? You never get cavities? Do you need dental checkup? Do you need to have your teeth cleaned if you've got a clean tooth in there anyway?
Yes, sir. Well, that's one great thing about dental implants is they don't get cavities, but that's not necessarily a free ride to not ever get it looked at again.
So what do you have to get it looked at for?
We need to make sure that the gums are healthy, that they're not causing inflammation. That inflammation could eventually lead to problems with the implant. So we want to make sure they're really clean.
You still got to brush your teeth a lot.
We need to clean around the implants, yes, and the teeth.
Need to be sure that we brush our teeth everywhere. And how often do you have to see the dentist if you have implants? How often should you see? Every 2 years, every year, every 6 months?
We really like to keep all of our patients on a 6-month recall if they have teeth. If they're not having teeth, then we'd like to at least see them every year to double check everything.
The main problem that you see when they come back, they're just as happy as can be and they're smiling, they got that white smile, they got the color they want. On a recheck, the main thing that you really want to look at is gums. What kind of gum disease?
Well, we're looking for inflammation more than anything. So we'll have red, puffy gums. Sometimes they won't be comfortable. A lot of times the patient will even know there's something wrong and we need to double check it for them.
Easy to correct?
Well, yeah, usually we can clean it through standard cleaning procedures and it goes well.
Kevin Law, thank you so much for coming to the Dr. Bob Show and teaching me on implants. I have to find my teeth and see if there's any that I think I need to have replaced. I think it's a wonderful thing that that you dentists can do to give us a smile that we want with dental implants. And thank you, you're a great teacher at the Dr. Bob Show.
Yes, sir.
We're talking with Stephanie Greiner, and we're going to be talking about teeth whitening. Tell me, did you try any over-the-counter products?
I did. I tried several different, the whitening toothpaste, the strips, even the at-home bleaching trays over the course of several years, and I just was not satisfied with the results and had a lot of problems with irritation and sensitivity.
And so you knew you had to go a step further. I think everybody wants that beautiful white smile. What apprehension did you have seeing a dentist about getting a white smile?
The main thing was I wanted it to look natural. I was afraid seeing a dentist and using a prescription strength whitening product that my teeth would be just way too white.
So what was your experience? What did they do?
Well, when I went in, Dr. Muriel, the first thing she did, she talked to me about what my concerns were, what end result I wanted, and then we talked about how she was going to alter the treatment plan and alter the strength of the bleach, fit me for trays to make sure I got the result that I wanted.
So they fit you with your own little mouthpiece. When you put the medicine in, was it be too much? Did it still get in your gums? Did it bother your gums?
It didn't, because they made the trays customized to fit my teeth and refit them several times. It required such a small amount of the stronger product. Everything stayed right where it needed to, and I didn't have any irritation.
How long before you noticed the results that I see right now, which is beautiful whitening? Your smile and your teeth are just gorgeous. Tell me, how long did it take before you knew you were getting the results you wanted?
I actually, after I put the trays in for the first hour-long treatment, and I could tell a difference immediately. And by the end of the first week, which I only used the trays 3 times that week. She said I could use it up to 7. I could tell a dramatic difference.
Was it as exciting for you as it was for Dr. Law that your teeth were looking so beautiful and the smile was so pretty?
I think so. I got so many compliments, and I was really pleased at how excited the Laws were, Dr. Kevin and Dr. Muriel, to see my results and that I was satisfied with them.
Isn't it wonderful to have a beautiful smile and it just makes you happier all the time?
It absolutely does.
Stephanie Griner, thank you for coming to the Dr. Bob Show.
Thank
have a beautiful
you.
smile and you're a beautiful person.
Thanks so much.
Oh, we're talking with Dr. Muriel Law, Doctor of Dental Surgery, and she's going to be asking our questions about that perfect smile, whitening of the teeth. Muriel Law, welcome to the Dr. Bob Show.
Good evening, Dr. Bob.
Tell me about a toothbrush. Should we use hard, medium, or soft?
Definitely use soft bristles.
And when we have a toothbrush, should we use a powered toothbrush or a regular toothbrush? Is one better than the other?
I definitely recommend the power toothbrush
Why would you want to use a powered toothbrush when I can just do this?
because the power toothbrush will do it for you and it will utilize the right movement and it will last for a whole 2 minutes.
A whole 2 minutes. Should we be brushing our teeth for a whole 2 minutes?
Yes, sir. 1 minute on the top and 1 minute on the bottom.
A minute. All right, I'm going to have to brush a little bit longer. I'm afraid I've been going about 48.2 seconds, so I have to prolong that. Why does it take that long? Because you got to take time with every quadrant of the mouth.
Every quadrant, 30 seconds on every quadrant of the mouth. Make sure you're on the front, on the back, on the
Top.
chewing surfaces, everywhere.
So in order to do that, it's going to take me a little longer. Let's talk about the toothpaste and the whitening. Are toothpastes good enough to whiten teeth, or how do they whiten teeth?
All toothpaste are going to remove stains, superficial stains. However, a whitening toothpaste with the American Dental Association logo on it will have a special agent, special chemical agent, polishing agent that will remove additional stains.
Now, when I go see the dentist, why is what they do in the dentist's office better than me using a toothpaste with whitening and removing stained toothpaste?
In office bleaching or the bleaching that you buy from the dentist, they will fabricate custom trays that fits perfectly to your own teeth.
Why is that important? You know, the teeth, if you've got a custom tray, so it doesn't bother the rest of the mouth?
Exactly. We want to make sure that bleaching agent delivers to your teeth only and does not leak onto your gum tissue and cause irritation and sensitivity.
So I can't just go get a tooth guard like the football players wear and put it up, put some goop in, put some of the whitening, and wear a tooth guard. Should have a special one.
It's better to have a special one to avoid any potential irritation and sensitivity. Plus, the whitening agent, the chemical agent that's found over the counter, is not as concentrated as the one I could provide in the dental office.
So that's a key point. In the dental's office, you're allowed to use a higher concentration. What's the name of that substance?
Carbamide peroxide.
Carbamide peroxide.
Yes.
So you can get that over the counter, but you have to get a higher concentration in the dental office. So the higher the concentration, the whiter the tooth?
Pretty much in less amount of time.
Less amount of time. When you're setting somebody up for whitening, you come to the office, tell me what you're going to go through.
I'm going to make a set of impressions, upper and lower impression, to fabricate some models. With those models, I'll make some custom trays. And the day I deliver to the tray to the patient, I will instruct them how long to use it. Usually we ask them to bleach for 2 weeks, every 3 or 4 months, and no longer than that. Each session will be about 60 to 90 minutes, and we'll make sure the patient brush and floss right before using those trays.
How long does it take to whiten the teeth?
It'll take about 2 weeks, 10 to 15 days.
And in that period of time, you take the stain out of the teeth, right? And you whiten it. How do you know how white you're going to get that tooth?
Well, we don't really know. We'll take a pre-shade before they start the bleaching, and then we'll have an appointment in 15 days, and we'll compare. We'll do a comparison.
And in 15 days, 2 weeks, you ask the patient, are you as white as you want to be, or you want to be whiter as far as the teeth go?
Usually they'll reach their
Maximum.
At
At that time.
that time.
And then you have to tell them you're going to use it how often after that first 2 weeks?
About every 3 to 4 months as a touch-up.
And it's a touch-up every 3 or 4 months for just a night, or
For 2 weeks.
for 2 weeks
at a time,
again
yes.
each time. Pretty effective.
Pretty effective, yes.
If somebody has staining of their teeth, not just from disc coffee, we see a lot of people, that, young children that were on tetracycline, they will have staining of their teeth that nobody can get white. What do you do with that in the dentist's office?
Well, we have this new way of, it's called deep bleaching.
Deep bleaching.
It's a combination of in-office and at home. For somebody with a severe case of tetracycline, it will take about 6 to 8 weeks in order to achieve a brighter and white smile. And this method, we can guarantee a lifetime whitening.
So if somebody has tetracycline staining, you can get rid. I didn't know you could get rid of that. How long have you been able to do that?
Only the past couple years. It's very recent.
It's a recent thing, and it's a new thing.
It's a very new thing.
Any danger to it or anything?
No, actually, a lot of people are afraid of sensitivity because it's more powerful, but the sensitivity is very minimum, or sometimes no sensitivity at all.
Any other condition that has chronic staining that people think they'd never get well? I know the tetracycline, we see that many, many times, and we say, oh, you had tetracycline in childhood. Any other condition that stains the teeth chronically?
Tobacco, old age.
Old age, as
Getting
we get older, our
the
teeth
get grayer.
more yellow and gray.
Yeah.
So can you get rid of that?
We can try with a deep bleaching for sure.
So with my old age, you think you can make me have white teeth?
Of course.
That's great. So you really have the ability to do so much as dentists. Muriel Law, thank you. You know, it's just a great thing to know that people can have $1 million smile, and you've taught us how to do that. And thank you so very much.
Thank you.